As the most trade and travel dependent region in the world, the Caribbean faced the equivalent of 2 decades worth of economic progress lost due to the halt on tourism during the COVID-19 pandemic. Experience is the greatest teacher, and health officials in the region are seeking to change the narrative from being reactive to proactive against active health threats of international concern by identifying and stopping them in their tracks before they reach Caribbean ports. From 11 to 12 September, St. Lucian representatives from the Ministry of Health attended a Caribbean vessel surveillance system meeting in St. Martin as one of the 4 pilot project locations for the mechanism.
St. Lucia was one of 4 countries to pilot test that system, and we had the opportunity to pilot test that system for a month and a half. Right? During the piloting phase, we highlighted a lot of gaps in that system and a lot of new features we thought that would have been beneficial to our country needs.
The panel discussion sought to cover all bases, expanding surveillance beyond cruise vessels to yachts, cargo ships, tankers, and other commercial vessels. It built on the past experiences the region has had with international health concerns, including norovirus and gastroenteritis.
We trying to provide surveillance for all vessels coming from an international voyage and not only focus on the cruise vessels because the risk is associated with all vessels.
The Caribbean Public Health Agency is continuing to develop an early warning and response tool to generate alerts of illness clusters on cruise ships in real time. This aims to allow diseases to be detected before the vessels arrive at local ports, allowing national authorities to respond quickly and alerting the other regional destinations on the ship's itinerary.
St. Lucia is signatory to the IHR, the International Health Regulation, and some of those core capacities under the International Health Regulation is our response, and establishing that system in St. Lucia would definitely increase our response capacity.
The workshop introduced a web application as part of the second phase of the surveillance system, where countries are able to enter data from the Maritime Declaration of Health electronically for increased regional communication and harmonization.
In terms of early detection, where that information will be available in real time. So if we do have a public health event of international concern, that information can be readily available and be provided to our response team.
St. Lucia was represented at the conference by the Chief Medical Officer, Dr. Sharon Belmar-George, National Epidemiologist, Dr. Michelle Francois, and Environmental Health Officer, Velen Sharman. For Choice News Now, I am Shyne Savory.